Good evening, and thank you for joining us again here on blackdoctor.org. I am Ellis Dean, the Director of Digital Programming and Production at blackdoctor.org. And I see I got a little shine, so y'all pardon me. I would be a little transparent today. My power is out of my house right now, and it's hot. I'm in Atlanta, Georgia, so it's starting to get hot and humid. So if I start sweating, it's not because I don't know what I'm doing. It's just because the temperature of my house is getting unbearable. But the show must go on, as they say. And so we are here. So a couple things I want to get before we get started with this wonderful program. As y'all recognize Dr. Coney from last time. Before we get started, a couple things I need you to do. First, I need you to let us know where you're watching from. So drop that in the comments. We like to know where people are watching us from all over the country. So drop that in the comments. Number two, what I need you to do is you have any questions, make sure you put those in the comments as well, because Dr. Coney is an expert. He can answer most of your questions. Some of those outrageous. I'm going to say most, because all is all encompassing, and y'all might try to test it. But most of your questions related to our topic about eye health. And then finally, if you know somebody that needs this information, please tag them, share this on your page so they can get this valuable information for them about their eye health. So those are the three things I need for you to do this evening. And I want you to give a warm round of applause, as I said, or good Coming to America, to the man of the hour, and that is Dr. Joe Coney. How are you doing this evening, Dr. Coney?
Ellis, I'm blessed, man. Thanks for having me on your show. Appreciate it.
You're looking sharp tonight, too. I'm liking that jacket. I'm starting to rate that jacket a little bit. I got a little orange in this shirt. Y'all can't see it. I got a little orange in this shirt. That jacket will lay up just nice against it. So it's all good. So if you missed the first show last month was Vision Health Month. I believe that's how they put it. It was Vision Health Month. And so we kicked off a 6-part series on vision, but not just specific any kind of vision. We're talking about diabetic retinopathy, and really because we know that Black African Americans are disproportionately impacted by diabetes. And as we learned in the last show, that diabetic retinopathy is a very, very real kind of problem that's associated with diabetes. Even if you're keeping your diabetes up to date, you can still develop diabetic retinopathy. And so we really wanted to make sure. And so we're going to do a 6-part series, and we're going to talk about all the different states. So tonight's show is about the importance of eye health. And how do you protect your eyes? How do you protect your vision and prolong that vision, even if you start to develop diabetic retinopathy? So Dr. Coney, before we get into tonight's topic, can you kind of recap and help the people that may have just joined us, let them know what is diabetic retinopathy and how does it come about?
Sure, Ellis. So in short, I think we all understand what diabetes is. It's just when your body sugar is just too high, and over long periods of time, that's when the complications occur. The problem with diabetes is that a lot of folks are undiagnosed or maybe pre-diabetic. Someone in their family, they may have diabetes. If you have a sedentary lifestyle or have high blood pressure, cholesterol, all these things are risk factors for diabetes. But once you're diagnosed with diabetes, then that's when and if you don't control it over time, you can get a lot of problems. One of those problems, what I do, is really the eyes. It also affects the heart, the kidneys, your toes. It's a leading cause of end-stage renal disease. So individuals can have a dialysis. People can have numbness and tingling in their toes. They can get peripheral neuropathy. They also can get amputations. If you have diabetes, you're more likely to get a heart attack and stroke. In the eyes, it's a leading cause of blindness, unfortunately. And for what I do, it's about 30 million people in the United States have diabetes, and about half of those, another half of individuals are undiagnosed. And so over long periods of time, high sugars causes damage to the back of the eye, and that's called diabetic retinopathy. These vessels, as the diabetes affects the blood vessels and the nerve tissues in the eye, the vessel starts to leak out fluid, and that fluid can accumulate in the middle of the eye. That's called diabetic macular edema, and that's the leading cause of a decrease in vision in diabetes. In the later stages of diabetes, you can get abnormal blood vessels. Those blood vessels can grow. They can bleed into the eye. They can cause tractional detachments, and oftentimes these individuals would require surgery. But I think the most important thing is that with early diagnosis, early treatment, the right staging, individuals are able to prolong their vision, if not have any vision loss at all. And what I tell my patients, particularly those that have not had any vision loss, There's no reason you need to have any vision loss if you keep your appointments. Because if I diagnose you early and diagnose you on time, I can preserve your vision.
Okay, so you hear that? So there's gonna be a theme for tonight's show, people. There's gonna be a theme for tonight's show. Go see the doctor. Go see your eye doctor, especially if you have diabetes. And so when we're talking about patients, people living with diabetes, you said that's a big number, 30 million. And then another half of that, approximately half of that, is undiagnosed. So they're walking around with diabetes and don't even know it. And that could be extremely dangerous because that means it's going unchecked. Their blood sugar is rising, falling, spiking, and whatever, and that could have an impact on the eyes. What I was curious about when we were talking in our previous discussion is how the body it sounds like, and correct me if I'm wrong here, the body is almost trying to correct itself by developing those extra blood vessels, right? When your vision starts to diminish, it said, okay, we're going to create some extra blood vessels to try to prolong the vision, but it's those extra blood vessels that are forming that become a problem because they tend to tear and leak blood into the eyes. Is that kind of the layman's version of it?
I think you're ready for medical school. That's exactly what it is, my brother. So in short, I think, God has made us, God has created us to be very special. And part of that has the ability to repair itself. I think the best analogy, particularly for those individuals that may have had a heart attack, for example, when you have a heart attack, you develop collateral vessels. Those collateral vessels help out the muscle of the heart that is not getting enough oxygen. Okay. Right. In the eye, it does the exact same thing. The problem is that when you have diabetes, this insult happens over time, and sometimes it's an acute process when you start to lose the oxygen, when you start to have dropout of your normal architecture. So the body tries to make these new blood vessels. They're not normal. They grow very fast in response to something they're missing, which is oxygen. They grow up into the eye and they fan out. And then, so when the eye moves and the vitreous moves, those vessels get sheared and they bleed into the eye. And because they grow out like a fan, it's kind of like if you've ever been to wine country and you see the grape leaves as they grow along that vine. Okay, right. It's scaffolds. So because it scaffolds, when the vessel starts to contract, it starts to detach the retina. And that's a sign of severe vision loss. And all those individuals most times will require surgery, particularly if it's sight-threatening.
Okay, so the takeaway is, number one, you got to regulate your blood sugar and get it tested. Even if you've got diabetes in your family, you got to know a family history. But if you've got diabetes in your family, you need to be making sure that you know what your blood sugar levels are at all times. Even if you haven't been diagnosed, that family history is kind of a good indicator of having diabetes, of you developing diabetes. Two, if you haven't developed it yet, if you're in that borderline range, do what you need to do to lower your blood sugar and keep it controlled. And the best way, as many doctors will tell you, is diet. Diet and exercise are the two best ways to control your blood sugar. And then, if you have developed diabetes, or whether you're recently diagnosed and you're going to go see it's an endocrinologist. Is that the person that? Okay.
Yes.
All right. So you got your endocrinologist, but you also need to go see your ophthalmologist and make those appointments. If you can make those on the same day, simultaneous, that would be great. Back to back, however you want to do it. But you need to be seeing your endocrinologist as well as your ophthalmologist each regularly, so they can kind of make sure that your eyes. Now, another thing that you mentioned, or maybe I heard this from another program, is that as an ophthalmologist, you can almost, when you're doing an eye exam, you can almost kind of predetermine if someone is either pre-diabetic, diabetic, or will develop diabetes just by that eye exam. I found it to be curious. How do you do that?
So, Ellis, this has to do with the same comment that you just said before, getting your eyes examined. Once you're diagnosed with diabetes, or even if you're pre-diabetic, and just as general health, you need to see an eye professional. But what that requires is us just dilating the eyes. And when you have diabetes, the most important thing is screening. The American Academy of Ophthalmology, the ADA, and all the other big organizations recommend that once a person is diagnosed with diabetes, they need to get a diabetic eye exam that particular year. So that's just that's the most important thing. Go in and get your eyes checked. So I guess your question is, what is that exam like when you go in for the first time and see an eye doctor and you have diabetes?
Yes,
And
please.
I think this is really important for your listeners because, they need to understand that in order for us to do our job, in order for us to take that deeper understanding to see what's going on behind their eyes, they need to be dilated. And dilate is simply just making the pupil bigger. We give them a couple drops. They sit in the office about 15, 20 minutes. The eyes get bigger. And then we can take a look at behind the eye. We can see diabetic retinopathy even before there's any vision loss. We can see the capillaries dropping out. We can see the blood vessels growing. We can see all these things. It's also important because glaucoma is very common in African Americans as well. And this is another way for us to look at the optic nerve, make sure the nerves are healthy. If you have blood pressure problems, we can look at the vessels and see if there's blood pressure problems in the retina. There's a direct correlation. So I know that by looking in the eye, I can tie this to a whole host of things in the body. So everything that affects the body really also affects the eyes. But again, the most important thing in order to get diagnosed early, to have those good vision gains and don't lose any vision, you have to go in and get a dilated eye exam at least once a year to make sure the diabetes is not affecting your eyes.
Okay, and just for people that know, if you have insurance, screenings are typically covered, right? So having your eyes dilated, getting that eye exam is typically covered, and you won't have to fight them for that. They want you to get screened, right? The problem is when you start having to get other procedures done. That's what the fight happens. But early on, you can be your own best advocate by going to get those screenings done, getting your eyes dilated, so problems can be kind of detected early on, and then a plan can be set in terms of how to prolong that vision health, how to prolong your vision, and try to deflect some of these issues instead of coming in when you've already started having that narrowing of vision. And I think that's what you said the last time we talked about it, was kind of like you start becoming your peripheral vision, you lose your peripheral vision first, and then or how does that process?
So with glaucoma, you can lose your peripheral vision first. With diabetes, most times the most common cause of vision loss is diabetic edema, and that affects your central vision.
Oh, wow. Okay. So
if you have both, you know you got problems.
Yeah,
you have both, you know you got problems. And
you know you got problems.
so part of that 30 million is that the numbers of Blacks and Hispanics are outpacing the rest of part of the country. So those numbers are not directly proportional. So when I say things are increasing, it's increasing disproportionately in the Black community and in the Latino community.
All right. Well, we almost can shut the show down right now. My apologies for that. Like I said, I'm on my Wi-Fi hotspot, so there's going to be some glitches. So I apologize for that issue. So moving forward, so outside of the exam, are there some things, because I know a lot of times when we do these type of programs, we like to try to empower our audience, empower our viewers to do some things on their own. So one of the things we said is, hey, have a regular seeing their eyes checked if they're diabetic versus non-diabetic.
So you kind of broke up there, but I think your question was the things you can do if you're diabetic, or just for general eye health.
I guess my question was, how often should somebody see the eye doctor if you're diabetic or if you're non-diabetic?
So, obviously, depending on your disease process, that will depend on how many times you need to see a physician. When it comes to diabetes, if you don't have any diabetic retinopathy, once a year is what's recommended. Once you have diabetes, depending on the level or the severity of the disease, you may be seen more frequently. And if you get undergoing therapy, it's not uncommon that some people may be coming in every 4 to 6 weeks, because some of our therapies are just that frequent. So in order to avoid those therapies that you got to come in every 4 to 6 weeks with, come in early and make sure that those things don't really pop up. And so, yes, we can have an indication, or we have a good idea or how an eye progresses over the next 1 to 3 years on the level of the disease. We have studies before we had therapy, natural history of the disease. That if you come in with severe diabetic retinopathy, we know that you can have severe vision loss up to 50% over those next 3 years. So those individuals we're following every 4 to 6 weeks just to make sure they don't develop those new blood vessels.
Oh wow! Oh wow! That's and just and, I'm just thinking about it in terms of the experiential part of that, is because when we're thinking about like how much we rely on our vision, right? And so to have that compromised, that it could impact your ability to be independent, right? So we're talking about is you may not be able to drive a car. You may not be able to work. That can impact your ability to work, because like for what I need to do, I need to be looking at a computer. I need to be sending emails and messages and things like that. If I can't look at the device and determine, that could impact someone's ability to work. So there's a tremendous amount of impact that can be happen just as a result of a loss of vision. So we have to make sure that, so that's the reason why we're doing this series. And we're going to continue to talk about vision health, is because how important our eyesight is to our daily functioning, that we don't even think about. We just say, hey, you open your eyes, you can see, you're good, you keep it moving. But really, we need to be doing some things to protect our eyes. So the question I was asking before, my Wi-Fi hotspot got glitched, was we're trying to empower our audience with some other things they can do. So the first thing we said was, have it go see your ophthalmologist on a regular basis. What are some other things that people can do in order to protect their eye health and to try to help prolong that healthy vision?
So that's a loaded question. And, when it comes to eye health, that encompasses a lot of different things. So different people may need, different tailored things. The most common, a lot of people always asking about foods. Are we always told that carrots was actually good for your eyes, right? Well, carrots.
My mom.
That's right. Eat your carrots. Well, carrots is good for the eyes because there's beta carotene that we need for the eyes. But the most important thing for the eyes are green leafy vegetables. Collard greens, kale, broccoli, spinach. Typically, the larger the leaf, the better it is for the eye, because they have antioxidant properties and they can slow down the aging process. Typically, we use this. We recommend this for macular degeneration patients because they have a normal aging process of the center part of the eye, where those antioxidants are very high over time, and it destroys the back of the eye. That's why it's called degeneration. Other things help for the eyes is fish. We talk about the omega, it's the fatty fish, the one with the omega-3s, the salmon, the tuna, the herrings. Those are extremely good. If you have thyroid disease, selenium is also good for the eyes. And so, we have a lot of people that come in with very prominent eyes because some of the proteins that's released when you have thyroid disease, they get deposited in the muscles. The muscles in thyroid patients swell, and then the eyes become a little bit more, we see them kind of bulgy out or kind of full. We call that proptosis or Graves' disease or thyroid eye disease. There's some also things you don't want to do. Smoking is notorious bad for any vascular problem in the eye, particularly diabetes, as well as macular degeneration. And macular degeneration, that was the one risk factor that we saw in our clinical trials, that people tend to lose vision if they were smokers. You already know that if you are a vasculopath, if you have bad blood vessels, if you have a peripheral vascular disease, if you had a stroke or you had a heart problem, you shouldn't be smoking. Those vessels in the eyes are extremely small, so they're very sensitive to those sort of things. Alcohol can also affect the optic nerve. Okay, people don't realize that excessive amount of alcohol, you can get an optic neuropathy. We have people that go blind just from drinking alcohol. And people don't actually realize that. Listen, you can have a problem with anything. Drugs are another problem. Unfortunately, we live in an area now where everyone wants to be happy with their mate. So even with Viagra can cause a different kind of tint to your vision. And if you have a coronary artery disease or high blood pressure, you can even get a stroke in the eye because it actually constricts the blood vessels. So there's all these things that you have to be aware of. It's not just, pretty much every particular medication can affect the eye in kind of some way. Anything that affects the body can affect the eye. people don't realize that although I'm a retina specialist, there's 9 different specialties just for the eye. That's
Oh, wow.
more specialties than any other part of the body. That's how complex the eye is.
My mind is being blown right now, and I'm torn because part of me wants to pick up this phone and call my mama and tell her all that carrots you had me eating did work. You should be making me some greens and some spinach, and try to get me to eat these carrots, which I did not like, for the record.
Now,
But
Ellis,
also,
I'm gonna build one more layer on top of the outside foods, because people always want to know, is there anything protective they can do for their eyes? And
okay,
glasses. My kids ask me this question because when COVID happened, they were stuck in their rooms and they was glued to a computer, and they
right,
were always wondering, was the blue light from the computer affecting their eyes? I get that question a lot.
right,
And unfortunately, we don't have the clinical data that suggests what long-term effects blue light have. We don't think that it causes any problems. Actually, you get most of your blue light from the sunlight. You can also get it from the light bulbs, okay? You can get it from your tablet, you can get it from your computer, you can get it from your phone. But I think the problem with looking at the computer for long periods of time is that your eyes get fatigued. They get tired.
mm-hmm.
You have muscles in your eyes. You have muscles in the eyes that are responsible for allowing you to see things up close. That's called your ciliary muscle. It constricts your iris and your lenses to allow you to accommodate. If you're reading for long periods of time, you can get headaches. Your eyes can get dry. Typically, you're blinking a lot, but when you are focusing on something like reading, you're not blinking as much, so the eye gets irritated. You have to take a break. So I use the 20-20-20 rule. Every 20 minutes, look 20 feet away, look at an object for about 20 seconds. That will relax those muscles. Okay? That's really, really, really important. And then blue light, it's also been recommended by the American Academy of Ophthalmology, is that this does affect your circadian rhythm. And so this light keeps, your circadian rhythm is important for your, waking up in the morning and going to sleep at night. So you either want to decrease the contrast of the computer late at night, or you want to stop using the computer about 2 to 3 hours before you go to bed. That will help regulate your sleep cycles, because even lack of sleep can worsen a lot of your eye problems. First of all, you can get double vision, you can get lack of concentration. Your muscles of your eye can actually, slide out sometime and slide in. That happens to me. So I have one dominant eye. So if I'm really, really tired, I can feel my eye drift. I blink and it'll come right back in. You can also get spasms around the lids from lack of sleep. And that can also come from also drinking too much caffeine. So these are all things that people come in with when the eyelids are spasm, or they come in with tension headaches, or they're reading and the eyes get very blurry or tired, or even they run a lot of fluid because the eyes get irritated. So just sleep. And when it comes to the blue light, we don't know if those glasses are helpful. But when it comes to protecting yourself from the light outside, because we know that ultraviolet light is also very damaging, particularly UVA and UVB, UVB being the worst for around the skin and the eyes, you want to make sure you purchase glasses that say UV protection. If the glasses says block at least 490 nanometers, that also means UV light. That means it's blocking 99 to 100% of that UV light. Polarized glasses are different. Polarized glasses doesn't mean that you're blocking UV light. It has to say that in there. There's 2 separate ways to make those glasses. But polarized glasses is basically decreasing the glare that comes in your eyes. And that's why, people that fish, people that sometimes golf, pilots, those individuals tend to like that, because, they can increase the contrast a little bit, because it makes things that looks further away, it makes them look a little more distinct.
Well, yeah, I do golf every once in a while, and I do have the polarized lenses for that reason, right? Because everything is clearer. When I put on regular shades, it was kind of that haze over it, and I was like, I can't see the ball is clear, I can't see things around. So I got the polarized, but I didn't know. It's good to know that maybe I need a lens that's more UV and polarized, which is probably going to cost more, but it is. They always charge you for good stuff.
Well, just understand how polarized glasses work, because if you're a golfer, most golfers don't like polarized lenses when they're putting. They like them when they're teeing off because they can see, but putting, so polarized glasses is just like having vertical lines in your house, blinds in your house. Okay. So the blinds will block part of the light, and the light that comes through the blinds you can see. So it only blocks the light that's coming in. The regular glass will actually block some of the horizontal. That's why things tend to be a little bit darker in polarized glasses. You probably notice that when you look at them and take them off, the images are a little bit darker, okay, and it blocks a part of the light. That's why it only blocks a lot of the glare. And this is important when the sunlight bounces off of surfaces which are flat. So if you're in calm water, or if you're looking at a piece of metal, when the sun hits that metal or that calm water, there's a direct path of light right into your eye, and it's very powerful. And that's where the polarized glasses are good for that. If the light rays hit a surface that's irregular, the light rays kind of diffract, so it doesn't bother you as much. But if it comes through a straight surface or a calm surface, that light gets directly refracted back into your eye.
Okay, so bringing this to our patients with diabetic or that could develop diabetic retinopathy, is that damage that could be caused by UV light and rays, is that accelerated because they have diabetic retinopathy, or is it just the diabetes that's doing most of the damage?
The diabetes is, in this case, is doing most of the damage, and it does take some time to develop, retinopathy. The problem is that when you have diabetes, we don't know how long someone's been diagnosed with diabetes when they're diagnosed, and that's why we want them to come in once a year. But it's really from prolonged periods of time where the sugars will cause damage to your own capillaries and your blood vessels, and that's all related to duration of disease and how high your sugars are, and other risk factors, basically high blood pressure, cholesterol, inactivity, like a sedentary lifestyle, all those things are really important. And I would throw smoking in the mix as well.
Obesity, I guess that's kind of a catch-all term, but really it's when your BMI reaches a certain level, you can get diagnosed. And I always try to make a point to get people to understand that obesity is not a description, it's a diagnosis, that you can overcome it. But it is definitely a risk factor when it comes to a myriad of diseases, including diabetes. And then we know that we're talking about diabetic retinopathy. So if you're just joining us this evening, we are talking to Dr. Joe Coney as part of our 6-part series with our partners at Genentech, talking about diabetic retinopathy. And tonight's focus is really about the importance of eye health and what you can do to protect your vision, whether you are diabetic or non-diabetic. But we're trying to really protect the vision, and we're looking at it through the lens of the impact of diabetic retinopathy. So it is fascinating. We've learned some fantastic things tonight. We learned that there are 9 different disciplines about the eye. Like, what are the smallest organs in the body, right? There's 9 different disciplines specifically related to eye health. We also learned that anything that you do, any other diseases, anything that you do, you ingest, you can lose alcohol, and we just think that's going to impact it can impact our life. We knew about smoking because it's smoke and the irritants, and we know the bad part about smoking, but I didn't know about alcohol. I had a moment right there personally about that. But all of these things can impact the eyes, including, we talked about how what happens with diabetic retinopathy and how those blood vessels are protective and also can be damaging simultaneously, because they can cause some vision loss over time if they start to develop from diabetes. And so, really, was that a good summation? I know I'm just trying to.
Excellent.
Okay. So, all right. So we got that. We got the regular. We talked about what a regular eye. We talked about shades and how they protect, and the difference between the UV rays and the polarized, which, because I like the polarized because everything was so clear. But now you're right, it does make sense, because I always take them off when I was putting. So I would just lift them up and make my putt and put them back down. So yeah, absolutely. So I'm going to make an appeal now to our audience. If you have any questions about your eye health, please drop that in the comment section and we will get to those questions. Also, if you have any questions about diabetic retinopathy specifically, that is a great question to ask. We've got an expert here, and we're going to be talking about eye health and how the importance of eye health and what it means to your long-term vision. So there is, as we all get older, our vision tends to go down. What can we do to slow that process? Because I know I went from being the only person in my family not to have any glasses, right? So that was always my calling card. Like my sisters had glasses early on in life. Mom wore glasses, my dad wore glasses. And I was like, I don't have to wear glasses. I maybe cheat those carrots a little bit that my mom was trying to make me eat for my eyes. But I don't know, I don't think I did anything special to protect my eyes, but somehow I kind of avoided glasses longer than they did. Now I wear reading glasses because my eyes tend to get tired from looking at computers and reading books, but I still don't have to wear glasses in my day-to-day life. Is that just the luck of the draw, or am I doing something specific regarding that?
So Ellis, from the time you're born, your eyes go through different stages. Your eye actually elongates, and that's what we mean by, things when someone become more nearsighted. It's just a longer eye. So where your eye is when you're a younger person doesn't mean where you are when you're a teenager. So it's the whole progress. The cornea shape, can actually change as well as you get older. And, that's when we talk about astigmatism, or there's this different disease of the cornea, which shows up like keratoconus, just the irregular, kind of shaped cornea. So all these things are nothing that, you've done to this, to have this. Now, there are predisposed things. Like if you're we have one of the risk factors for keratoconus is like Down syndrome babies. They rub their eyes a lot. So, or people that have really bad allergies, we call it atopic, dermatitis. They rub their eyes a lot. So people that rub their eyes, you can actually change the shape of your corneas, but you got to rub them pretty vigorously. The normal person who's rubbing their eyes probably is not going to have a problem. There's also a theory about, when you're a child, depriving your child of sunlight. We thought that sunlight stunted the eye from actually growing, or actually maybe made them more nearsighted. And I don't know where the theory is on that, but I know there was something out there that was before. So there's always these things is, can we stop the elongation of the eye? There's some trials going on now where putting eye drops in kids can actually maybe decrease their level of nearsightedness. And so that's one thing that people are working on. There's different cultures that have much more high myopia, particularly like Chinese individuals have a very long eye. And so they're more prone to having high degrees of myopia. It doesn't just affect Chinese people, it affects everyone, but it's still a process they're looking at to see if we can don't have to have those long eyes. If you're born early, like if you're born like premature, a lot of these eyes can also be very myopic. Those are also, very long eyes. And so you cannot change at the time you're born. If you came early, it's a blessing, and we're hoping that you're able to see and everything function right. We just want a healthy baby, but we have to deal with all these things that may become issues later on. Those individuals may also be risk. They have a higher risk for glaucoma or having cataracts. So all those things change. Some things may be inheritable. Cataract sometimes is inheritable. We have babies that are born with cataracts. There are certain metabolism things that, or enzymes that babies aren't born with, which will make their cataracts grow faster. Particularly if you have a child.
Help us understand what cataracts are, because I don't want to assume that everybody knows. I've heard the term, but I don't want to assume that people know what cataracts are. So kind of help give a working definition of what cataracts are.
So cataracts is the normal aging and clouding of the lens itself. The lens is the part of the eye that helps focus the light on the back of your eye called the retina, which goes to the brain, which will allow you to see. So It's like the lens in the camera, except for when you get older, it gets cloudy. It's kind of like an onion peel. If you cut an onion in half, you see the rings. If you cut a tree in half, you get the rings around the tree. That dates on how old that onion is or how old that tree is. It's the same concept when you get the cataract. The more rings you get, the more cloudy it becomes over time.
Okay.
And then for children, some kids are born with glaucoma. They have a problem where the water in the eye, the fluid in the eye, cannot get pumped out. So because in children, the sclera, which is the white part of the eye, is malleable. It can be stretched. And so when the pressure in the eye goes high, the whole globe can actually get bigger. So they'll have one big eye just because of pressure in the eye side. And so these are all things that may be congenital that can change the shape of the eye over time, or even change your refraction over time.
Okay. So I think for me, I'm an allergy sufferer. I'm a seasonal allergy guy. And that's typically one of the things that gets impacted is my eyes. And I've always start, as soon as I walk outside, I know if there's pollen in the air because my eyes will start itching, right? And I have a grass allergy, and we got a lot of pollen and grass here in Georgia. So
and you're a golfer.
And I'm a golfer, which is a bad combination. And I played a lot of sports as a kid, and so that was difficult, right? That was a challenge because I was rubbing my eyes a lot until I realized, because I didn't realize I had allergies until probably high school, college. It was just, I just knew that when I got tackled on grass, my skin itched. If I was cutting too much grass, my skin itched, and I would sneeze over and over again, and I didn't understand why. And it wasn't until I got older, I was like, oh, I could take some medicine and it'll help. But that rubbing of the eyes, does that scratch the cornea? Does that accelerate any of that process?
Well, that's two different things. So scratching the cornea is a physiological, well, is a mechanical problem, right? So you can't scratch the cornea by rubbing it too hard. You can scratch with a nail or with anything you can scratch the eye with, and that's really painful because what people may not know is that there are more nerves in the cornea than any other place in the body. That's the reason why if you get a piece of sand or a piece of hair in your eye, or you get a bad contact lens, it hurts like the dickens. It's because there's so many nerve tissues on the cornea. So when you get allergies, that doesn't, well, it can affect the cornea in some people, but most time it affects the tissues around the eye, like the conjunctiva, or even underneath the lid, we can see these little bumps. It's like little lymphoid tissue, which helps. It's part of your body immune system. They can get swollen, and that's how they're able to diagnose you with allergic conjunctivitis. And there's good drops for that. There's even drops over the counter right now, very good drops for like antihistamine. And I use them. I have the same problem you have. I'm a golfer early in the season. I don't know what I'm allergic to, but I can't focus. My eyes are burning. I just want to pull them out. I put a drop in. Literally 15, 20 minutes later, it's gone. So they work really, really well.
Okay. So I want to make sure that we're keeping, we're talking about overall eye health, and we've got two main categories that we're talking about here tonight. So one category are those people that aren't diabetic, and we're just saying, okay, here's kind of a generalized what you could be doing to improve your eye health and keep your eye health, kind of stable over time. And then foods, because I know it's always a big question Dr. Coney gets, and he talked about that earlier. Foods, green leafy vegetables, right? We understand that. So eat those green leafy vegetables, get those fatty fish. You like the salmon. I know Black folks, we like some salmon. So just keep eating the salmon, keep eating the salmon and the fatty, your salmon, what'd you say? Cod?
Salmon, tuna, and herring.
Tuna and herring. Yeah. Okay. Yeah. I had tuna fish sandwiches too. I grew up poor, so we had tuna fish.
And the best vegetable for your eye that has the highest amount of lutein is kale.
Kale.
That kale smoothie sounds good about now, right?
No, it doesn't. It doesn't. Maybe to my wife. She's a big kale fan, and now I just gave her more ammunition for me to eat.
Now, if I can add one other thing, this is interesting, and I think your audience can benefit from this because we see a lot of younger people with this, and it's a condition called central serous cortical retinopathy. Now I know that's a big word, but just follow the story. I like to call it CSR. CSR typically happen in younger men, healthy men, ages between 35 and 50. But the commonality in most of these people is stress, type A personality, okay, and they can be using any type of steroids, whether it's inhaled steroids for asthma, whether it's topical steroids for dermatological problems. They can have low T, and they can be taking excess testosterone for low T, or just taking any kind of steroids for any kind of problems or for joints. What happens in the eye is that there's a switch that happens where the cortisol levels kind of changes how the body handles fluid. And there's this fluid that accumulates in the middle of the eye, which can cause your vision to go blurred. Now, 90% of the time, this goes away, but in some people, it can become chronic and people can lose their vision. But they definitely want to get in and actually be seen and diagnosed. Now, the way you treat it, is obviously you want to control stress, because stress is a silent killer. But I want your audience to know, but stress can also have effects on the eye. That's the part I'm trying to get to. And then another way to help it out is actually the appropriate amount of sleep. People don't realize that sleep can affect the eye. And you want at least, we get more and more and more on our plate, and it's just like not enough time to do the things that we have to do. So trying to find that sleep is actually really, really tough. But you want a minimum of 5 hours of sleep, and that will help with the spasms around the eye, give those muscles time to relax. It also helps you kind of focus, better. People that get lack of sleep is also put you at risk for other heart diseases and also high blood pressure and lack of concentration. But you also can get double vision just from being having lack of sleep too. So these are all the things which I think is good just for your mental health, good for your physical health, as well as for your eye health.
So, last week we did a show on men's health, right? And so one of the things we had a specialist, Dr. Griggs. I'm gonna give him a shout out about that. So Dr. Griggs talked about sleep apnea. And how its impact on having, and he talked about the symptomology. I'm not going to give you all the stuff. You got to go back and watch it. But one of the things he mentioned with sleep apnea is it has a direct connection to cardiovascular disease. And one of the reasons is there's a spike it causes a spike in our blood pressure and a spike in our blood sugar. So we're talking about diabetic retinopathy. So that's another, and so you're talking about sleep and getting the proper amount of rest. If you have sleep apnea, that could have an effect on your blood sugar levels, which can have an effect on you developing diabetic retinopathy.
Now, you remember I told you anything that affects the body affects the eyes. Well, sleep apnea also affects the eyes. It can worsen your diabetic disease, actually. Mm-hmm. You can also have a stroke of the optic nerve. It's called ischemic optic neuropathy. Okay, so when that blood pressure spikes, guess where it spikes to? The optic nerve. You get lack of circulation. So sleep apnea also affects the eyes as well.
You got guys. So all right. So as we're here with Dr. Coney. If you're just joining us, we're here with Dr. Coney, and we're talking. This is part 2 of our 6-part series with our partners at Genentech about diabetic retinopathy. And so tonight's main topic, we're talking about the importance of eye health. So we're talking about all these different things that impact the eye health. Some of them are just environmental. Some of them are what you do. Some of them are just age related. And there's a lot of things that everything that happens in our body impacts our eye health. So that's number one. Anything you put in your body can impact your eye health, whether for the positive or for the negative. So gotta cut the smoking, gotta cut back on the drinking, those sugary foods, because that spikes our blood sugar. And we're talking about diabetic retinopathy. Those fatty foods, because cholesterol and things like that have an impact on our eye health. We also learned that outside of the heart, probably the eyes have more doctors associated with it, more specialties associated with than any other particular organ, and that is, I found that to be fascinating as well. So we're here. So now the steps that we want to kind of repeat what we've been saying. I'm a rinse and repeat guy. So number one, if you haven't seen your ophthalmologist, make an appointment. Right, that's the number one thing. That's kind of the best thing so you can get where you are in terms of your eye health, and you can work with your ophthalmologist in terms of either slowing the process if something has already started. If your eye health is good. Hey, go see them once a year just to make sure that nothing has happened throughout the year. Especially if you have diabetes, you should make that appointment immediately and have it ongoing. Number 2, there are some foods that you can't eat that will help eye health, because we're talking about those food rich in antioxidants and the omega-3 fatty acids, all of those things that we talk about having a healthy diet. Guess what? They also help your eyes too. We've been saying that a lot of times. So they help your eyes as well. And then finally, we got to get our rest, right? He's saying 5 for an adult. I would say 7 to 9, if you could get it, 7 to 9 hours of sleep to relax the eyes. There is still inconclusive on those blue lights that we get from our computers and televisions and handheld devices, but it can't be good. We learned something that you can do. 20 minutes of reading or 20 minutes of watching, looking at a computer. Look up for 20 seconds, look at something 20 feet away for 20 seconds. That'll help relax those eye muscles and kind of stave off. We're trying to stave off the myopia on that one. Is that what we're trying to stave off with that?
Well, you're just trying to relax your accommodation, because when you read a lot, you get these headaches, those sort of things.
Mm-hmm. Okay. So I think, and then then we learned about, we said CSR, which is stress related. So I knew a lot of us, our country is full of stress right now.
That's right.
The pandemic has us stressed out. What's happening in DC, inflation, there's enough stress to go around. And so that stress can have an impact on our eyes.
And that's why I mentioned that, because a lot of our people have asthma too. And they have to understand that those steroids they're using for their asthma can also have, so steroids can have a couple effects. I should add this in too. Steroids can also increase your risk for glaucoma. It can also increase the progression of your cataracts, and it can exacerbate the complications of central serous choroidopathy, or CSR.
So that's why if you have to take a steroid, your doctor always prescribes it for a short period of time, because while it can have some short-term benefits, over time, we can say, detrimental to the eyes and other areas of the body. So you just got to be careful when we're taking those steroids. And when I'm just thinking about like cancer patients, typically have to take, steroids. And then we were talking about lupus, earlier, and they take steroids as well. And so that could have some impact on their eye health and vision.
And Dean, I didn't, and we did not go into this here. It's not enough time and day to talk about all the diseases, but lupus is also a leading cause of blindness in African Americans. Were you aware that also affects the eyes? Lupus.
I did not. I just knew, I'm learning about lupus. Every time I feel like I'm in medical school when I work for BDL. Like
sarcoid, lupus, sickle cell disease. All these things are much more higher common in African Americans, and they have a tremendous impact on vision.
Yeah, I just thought lupus was about pain and rashes. Now I didn't realize that it was a leading cause of blindness in lupus patients. And then understanding, so for our audience here, lupus affects Black women. It's a disease that really impacts women. I think about 90% of lupus patients are women, and then Black women are about 43% of lupus patients. So you're talking about Black women that aren't a large percentage of the country, but represent a disproportionate amount of lupus patients. And here's the kicker, and Dr. Coney, that I did learn that it takes approximately 6 years for someone to be diagnosed with lupus. So over that time, they could be having lupus and not be diagnosed with it, and not be having it and not have it treated, and that could have an impact on their vision health as they're not being diagnosed with lupus and getting that. And if you're not diagnosed, then of course you're not going to go see your ophthalmologist, which is why you should go see your ophthalmologist whether you have vision problems or not. For that reason alone, because we don't know if you're not diagnosed, if you are not getting your blood sugar checked, or if you don't realize you're pre-diabetic, you're not going to see the doctor. A lot of these things could be really impacting your eye health, and over time, you may not have it. You might just have a little something here, a little something there, and then something catastrophic happens. And then you go see Dr. Coney, and he said, "Why didn't you see me 4 years ago or 5 years ago when this started happening?"
Yeah, a lot of these things are really difficult to do. And I think you hit something really, really important. Physicians rely a lot on ancillary tests, blood tests, these sort of things. The good thing about what I do, I don't need a lot of tests. I can look in the eye and I recognize patterns. And most of medicine is 90% of what they tell you to help you come up with a differential diagnosis. For me, it's what I see. If I don't see it, it doesn't exist. Now, there are things we have to do, obviously, for some ancillary tests, specifically for different systemic diseases. But, the correlations of where it happens in the eye, if it's superficial vessels, deep vessels, the location, sometimes race, ethnicity, we can rule out some things as well, or actually rule in some things. All these things we do to help make the right diagnosis. But oftentimes, we are the first ones to make the diagnosis, even before the rheumatologist and internal medicine doctor can actually come up with a definite conclusion.
Because blurry vision, headaches, tired eyes, that could drive somebody to the doctor, and they could have other underlying conditions. But you say But when our vision is impacted, that could be a symptom of something bigger. Is that what sounds like what you're saying? And so you go see the eye doctor. Oh, I got something about my eyes. They aren't working right, doc. It's like, well, because you got diabetes, right? Or because there's something else that's going on. You might want to go see this other doctor. And so, the bottom line is, don't wait, right? Don't wait until you have a symptom before you go see the doctor, because when you have a symptom, that means that particular whatever's causing that symptom has been happening in your body for a period of time in order to develop a symptom. And when you develop a symptom, depending upon how and where that symptom is developed, it can have some serious long-term impact on your overall health if you haven't been seeing a doctor on a regular basis. So, Dr. Coney, as we're wrapping up here, this hour is kind of flown by. As we're wrapping up here, what are some things, I guess, a kind of a checklist that for especially for our diabetic patients, what's a checklist of things that they should always be cognizant of, or should be looking for in terms of their eye health?
Well, for number one, I think they always should be monitoring their vision. And I think the best way to monitor your vision is check the eyes one at a time, because you can have a problem in one eye, but if the other eye is not affected, it will compensate, and you're not aware that the other eye has a problem. So oftentimes we'll have people come in, they may have lost several lines of vision in one eye and a couple lines in a good eye, and they come in when they notice things are blurred. Well, one eye has been now bad for a few years. So again, the earlier diagnosis tend to lead to better visual outcomes. So monitoring eyes separately, I think, is really, really important. Keeping up with your routine appointments, annually, if you don't have any retinopathy, and then whatever the treatment plan is for the physician, that's really, really critical. The problem is that with our diabetics is that, and we tend, and this is not always true, but diabetics are very non-compliant for a lot of reasons. Some of them are just non-compliant because they're just non-compliant, okay? But some people are non-compliant not because anything that they wanted to do for them, anything that they intentionally caused. Life is complicated. When you have diabetes and when you have diabetic macular edema, we know that you are taking on average 24 to 25 trips to the doctor in a year. Okay. And so you can have a problem where you had to go to the hospital, and so that threw off an appointment. Or you can, you're seeing your endocrinologist, your family medicine doctor, you're seeing your podiatrist, you got your dentist, you got a cardiologist. I mean, life is complicated. And then you got kids and grandkids. And so you can't always make those appointments. People have higher social determinants of health. Driving to an office is an issue. So just because someone doesn't make an appointment doesn't mean they're always not compliant. But keeping those appointments, I think, is probably the most important thing. Getting there early, be diagnosed, and keep monitoring the vision. Then the other thing is just controlling all the other comorbid problems. Being compliant with your medication. If you are on medications and you can't afford your medication, don't just stop the medication. Don't get them. Let the doctor know, is there any alternatives to this blood pressure medication that's costing me $300 a month? Is there something else that can lower my blood pressure down? Because compliancy is a big deal, but sometimes we don't feel comfortable in talking to our doctor about these things. But this is your health. You need to be in control of your health. And I think the more you can drive that discussion with the doctor, the more the doctor can understand your circumstances. And it may not be the one that he wanted to prescribe, but the alternative drug did the job. And that helped you control your blood pressure, which also helps control your eyes. Because you can have excellent diabetes control, but if your blood pressure is uncontrolled, your retinopathy would get worse. Can I say that one more time? Yes. If your sugars are well controlled, but your blood pressure is not, your retinopathy can get worse. And that's really, really critical. And we know when you have kidney disease, we know we can have eye problems. So it's just all controlling everything else, getting the exercise, getting the sleep, eating the right foods. Just do the best you can. Just have a health, clean life, and make all your appointments.
And we'll let that be the last word of the evening, because I can't follow that up with anything else better than what Dr. Coney just said. Again, thank you all for joining us. We want to thank our friends at Genentech for being a partner with us with this program. And thank you all for joining us and watching this evening. And we will see y'all next month as we will bring back Dr. Coney and talk more about your eye health. Until then, keep your eyes open and keep them safe.
Ellis, thanks for having me.